Pregnant and recently pregnant individuals are more likely to get severely ill with COVID-19 as compared to non-pregnant folks. Severe illness involves illness that requires hospitalization, intensive care, or a ventilator, or special equipment to breathe, or illness that results in death. In addition to this, pregnant people with COVID-19 are at increased risk of preterm birth and other adverse pregnancy outcomes as compared with pregnant women without COVID-19. If you are trying to make a decision about whether to receive a COVID-19 vaccine or not while being pregnant, consider your risk of exposure to COVID-19, the potential risks to your fetus or infant, the risks of severe illness, the known benefits of vaccination, the known side effects of vaccination, the limited but growing evidence about the safety of vaccinations during pregnancy, and how vaccination might pass antibodies to the fetus. Clinical trials to study the safety of COVID-19 vaccines and how well they work in pregnant people are in progress or planned. Vaccine makers are also collecting and reviewing information from individuals in the completed clinical trials who received vaccine and became pregnant. On the basis of how these vaccines work in the body, specialists believe they are not likely to pose a risk for people who are pregnant. But currently limited data is available on the safety of COVID-19 vaccines in pregnant people. The Moderna and Pfizer-BioNTech vaccines are mRNA vaccines that do not contain the live virus that produces COVID-19 and therefore cannot give someone COVID-19. Furthermore, mRNA vaccines do not interact with a person's DNA or cause genetic changes, as the mRNA does not enter the nucleus of the cell, where our DNA resides. The J&J, or Janssen COVID-19 vaccine, is a viral vector vaccine, which uses a modified version of a different virus, the vector, to deliver important instructions to our cells. Vaccines that use the same viral vector have been given to pregnant people in all trimesters of pregnancy, including in a large-scale Ebola vaccination trial. In these trials, there were no adverse pregnancy-related outcomes, including adverse outcomes that affected the infant associated with vaccination. Findings in animals receiving a Moderna, Pfizer-BioNTech or J&J or Janssen COVID-19 vaccine before or during pregnancy discovered no safety concerns in pregnant animals or their babies. Current reports have shown that people who have received COVID-19 mRNA vaccines during pregnancy, predominantly during their third trimester, have passed antibodies to their fetuses, which could provide them protection after birth. Side effects can come about after receiving any of the accessible COVID-19 vaccines, particularly after the second dose for vaccines that require 2 doses. Pregnant people have not reported dissimilar side effects from non-pregnant people after vaccination with mRNA vaccines. Rarely, some people have had allergic reactions after receiving a COVID-19 vaccine. The vaccines have not been studied on lactating people, therefore there is no data available on the safety of COVID-19 vaccines in lactating people, effects of vaccination on the breastfed baby, and effects on milk production or excretion. Based on mechanism of action of these vaccines in the body, COVID-19 vaccines are considered not to be a risk to lactating people or their breastfeeding babies. Hence, lactating people can receive a COVID-19 vaccine. Recent studies have indicated that breastfeeding people who have received COVID-19 mRNA vaccines have antibodies in their breast milk, which could help protect their babies. Additional data are needed to ascertain what protection these antibodies may provide to the baby. Would-be parents can also receive a COVID-19 vaccine, as currently there is no evidence that any vaccines, including COVID-19 vaccines, cause female or male fertility problems or problems with getting pregnant. If you are trying to become pregnant, you do not need to avoid pregnancy after receiving a COVID-19 vaccine. Like all vaccines, researchers are studying COVID-19 vaccines thoroughly for side effects, and findings will be reported as they become available. If you have questions about getting vaccinated, have a conversation with your healthcare provider. Don't forget to consult your health professional if you have a history of allergic reaction to any other vaccine or injectable therapy, whether intramuscular, intravenous, or subcutaneous. Do your part and get vaccinated against COVID-19. Together we can achieve the herd immunity.